I think. Do you want me to lower this?
I don't think you can.
Oh, okay.
It's down away.
All right, one sec. Let me... see if...
Are you live right now?
Yeah.
Oh,
So
thanks for telling.
I said we were going live. Okay, so yes, we're not. We only got 2 people. No, it's not. Say hi. Anyone got any questions?
Do the 2 people out there have questions?
I don't know. So maybe we'll just have to. Oh, this person said, "Hey, how often do you see surgeons come from the military?"
Not very often.
Wasn't Dr. Spector in
one of my partners is from the military, but I don't. I mean, they're out there. Just I don't know how many. Not very often.
Yeah. Sorry. Let me. Okay, Linda, what's your question? Just put your questions in the chat. You want to explain who you are, maybe?
Yeah. So I'm Brian Hoeflinger. I'm a neurosurgeon in Toledo, Ohio. It's our first time on YouTube. We've done some TikTok lives, but haven't done a YouTube live. So we thought we'd try YouTube live tonight. So we're just going to do a general question and answer session for questions you might have.
Or let us know if there's any topics you want us to talk about or want him to talk about. This person said, "Is there anything you have to avoid doing to maintain hand quality high? Like to keep your hand quality, like so you don't mess up your hands."
No, not really. I mean, I think at surgery you do a lot of use of your hands, obviously, and that's the most exercise I get as far as my hands go. So, but there's nothing else I do to keep my hand quality good.
This person put, "What was it like doing your first surgery on someone?"
Scary, because when you're in residency, you always have someone there with you. The attendings are there, and then when you get out in private practice and you're on your own, it's kind of scary because no one's there to bail you out if something goes wrong.
I want to know why my surgeon did tell me all the truth about my ALIF. I don't know what that.
Yeah, that's between you and your surgeon. Unfortunately, I can't tell you.
I can't give medical advice, unfortunately. What is the most complex surgery?
Most complex surgery I've done is probably a deep brain tumor, but if that's what you're asking, what's the most complex brain surgery I've done? I don't think there's any one most complex surgery, but the most complex I've done is a deep brain surgery.
Okay, and then this person said, "Hi, Dr. Hoeflinger. Thank you for hosting this AMA." So,
AMA?
It means ask me anything.
Okay.
Internet speak. I actually just sent you an email. Yeah. One thing is, we get tons of emails, but you can't give we can't give medical advice.
Yeah, I mean, I just can't do that. I can answer general questions, but I can't give medical advice. If I see somebody in the office as a patient, obviously I can give advice to them, but I can't unless I see you face to face in the office and can talk to you and examine you. I can't give advice.
Yeah, if you guys like this, give the stream a like. Maybe share with other people. This person said, let's see. I was wondering when and how you'd know you wanted to be a neurosurgeon.
Yeah, I mean, there's a story behind it because when I was a senior in high school, I was signed up to go into marine biology, and then my brother Eric, my older brother, got in a car accident, had a brain injury, and had surgery in the middle of the night, and he was in a coma for 6 months, and I came, hanging up in the ICU where my brother was for a couple weeks. I became interested in neurosurgery, and that's when I decided to change careers, and I dropped out of marine biology and went to school to become a neurosurgeon. That's what I did.
Let's see. Yeah, so let us know any questions you guys got. Is neurosurgery residency the hardest out of all residencies?
It's one of the hardest. I don't think it's the hardest, but it's certainly one of the hardest. And that's just because the kind of surgery we do, with the hours you have to put in, enormous amount of hours and a lot of responsibility, and you don't get a lot of free time. So it's pretty strenuous.
Could you elaborate a little bit on brain aneurysms? My brother had one and had flu-like symptoms.
Yes, well, a brain aneurysm is like you ever see a garden hose that has like a bubble off the side of it, a weak spot off of it? So an aneurysm is like a balloon or a bubbling off of of a blood vessel. And so that the aneurysm, can rupture. And if it ruptures, you know, people die from that. Usually when the aneurysm ruptures, people have bad headaches, they're nauseated, they close their eyes, their neck hurts them. Sometimes they come in a coma, but usually flu-like symptoms won't be related to an aneurysm itself. Like if an aneurysm hasn't ruptured, most aneurysms are asymptomatic. They don't cause symptoms.
Look. Yeah, for anyone who's joining in, this is Dr. Brian Hoeflinger. He's a neurosurgeon. Um, I'm sorry to hear what happened to your brother, and I'm glad you're out there helping people, as someone said. Is it possible to remove half of the brain, and if so, what age? Would there be any deficits if the surgery was done at a young age?
So you can remove half of the brain. What we did, the 2 or 3 of those during residency, is called a hemispherectomy. Usually that half of the brain is deformed or has a problem. It's not a functioning part of the brain. So it can cause deficits. Sometimes it doesn't cause hardly any deficits at all, but you can remove half of the brain, yes.
I heard if you sneeze hard enough, it can create a brain aneurysm.
It could maybe rupture a brain aneurysm, but it probably won't create one.
Skycat said, "How do you maintain your composure and professionalism during high stress situations?"
Yeah, you just have to keep your cool, and you can't get mad at other people because you're having a hard time. So, when I get in a situation that's tough, I just kind of stop for a minute, take a deep breath, and just remember you've done it a lot of times. You just do the same thing over to get yourself out of it.
This person said, "What should I do for a sprained ankle?"
And consult your regular doctor or orthopedic doctor. Yeah, I don't know much about sprained ankles, so I can't tell you.
Outside of the range of specialty. During medical school, did you struggle with imposter syndrome? And if so, what helped you get out of that mindset?
What's that?
Like imposter syndrome, like you're not good enough. You don't belong here.
Oh yeah. Yeah, I don't know. I mean, I didn't have much of that, honestly. I don't know how to answer. I didn't have to go through that, whatever, the imposter syndrome. So, I always knew what I wanted to do, and I never doubted myself that I could do it for the most part. So,
this person said, "How do you figure out which specialty you want to go into?" Please respond. I really want to go into medicine.
Well, you almost have to wait to get into medical school, right? So, you can kind of get an idea. First decision you need to make is I wanted to go into medical field, right? I want to go into medicine. And then from there, you go to college, get into medical school. And even the first 2 years of medical school, it's just book work, So your third and fourth year of medical school, that's when you start doing rotations. And that's when it solidified neurosurgery for me. Like, I remember I did OB. I didn't like it. I just didn't like being in there in a private situation with a woman having a baby and I'm standing there. So it really turned me off. I did psychiatry. I didn't like that. So you'll learn what you like and what you don't as you go through medical school.
The person wanted me to say hi to you.
Oh, hi.
Hi from Argentina.
Nice. Wow. What time is it in Argentina right now?
How much was psychology talked about for neurosurgery?
Not much. We don't really learn much at all about psychology for neurosurgery.
This person said, "What are your thoughts on surgical techs?"
They're awesome, and they're invaluable in the operating room helping you out, yeah. A good surgical tech can make all the difference between a good surgery and bad surgery.
I don't know if you heard, but there's a doctor named Dr. Sergio Canavero who wants to transplant a head onto another body. Is that possible?
Yeah. I've read about that. I think it's on Facebook or something. I don't know how it's possible at this point. So I don't believe it, so I don't know anything about it, but it doesn't sound reasonable at this day and age.
This person said, "Hi, sir. Love from India. I am doing my first year MBBS. It's 5:42 a.m. here. Really, I want to become a neurosurgeon. Please wish me luck."
Yeah, you can do it. You just got to set your mind to it, and you can't give up. And then when things get tough, you have to just keep going, right? And you have to keep remembering, I want to be a neurosurgeon. But you can do it.
Bill said, "What do neurosurgeons do for fun?"
This neurosurgeon for fun likes to golf. I like to be outdoors. I like the water. I like to go swimming. I like to scuba dive. I like to do active things when I'm not at work.
This person said, "How's the grandbaby, Kimmy? How's the grandbaby? When are we going to see him again?"
Yeah, grandbaby's doing well. We were just gonna put out a TikTok. I think something about he's able to hold his head up now, which happens around 3 to 4 months. So I think we took a video of him trying to hold his head up. So there'll be one coming pretty soon, but he's doing awesome.
How tall are you?
I'm like 5'9.5".
What came first, the brain or consciousness?
Yeah, who knows? I don't know.
So, yeah, if you guys are liking it, give the stream a like and share and follow. Put out a lot of content like this. Your grandbaby is beautiful.
Thank
Yes.
you. I'll let my daughter know.
What parts of the brain are responsible for daydreaming?
For daydreaming? That's a good question. I would think it's your frontal lobe.
Yeah. Are the stereotypes about neurosurgeons true?
What are the stereotypes?
Yeah, what stereotypes are you talking about in specific, Dina? I'm 25. His son is reading the questions. Okay. Your contact is directly responsible for my 13-year-old to be a neurosurgeon. I don't know what that means.
Nice. Got a long way to go, but
Is Alzheimer's hereditary?
Alzheimer's?
Yeah.
I think there is some component, hereditary component, but most of the time it's not. It's an age-related phenomenon in most people.
Do you know Derek Shepard?
No.
Have you ever considered?
Wait, who is Derek Shepard?
That's the guy from Grey's Anatomy. Oh. Have you ever considered quitting?
No, not yet. So, by the way, ask my son Kevin. He's reading the questions for me, helping me set this up.
Let's see. Do you ever get emotional when it comes to any of your patients that you treat, like if they pass away or the outcome is not good for them or something along those lines?
Yeah, I mean, there's been times if I've been with the family and we're discussing something really bad and they start crying, it becomes very emotional. I don't actually probably start crying with them, but I'm definitely right there with them, and I just, you just stop and you let them say what they need to say, and as long as it takes, I sit there and listen to them.
Can you provide any information on migraines?
Do what?
There's a lot of people asking about migraines and stuff like that. Do you have any thoughts on migraines or any information?
Yeah, I mean, migraines. There's so many different types of migraines that you can get, and there's a lot of medications out there now, new medications all the time that can treat them, and so you really want to get on something that will prevent them. So, I mean, you really need to get to a neurologist who specializes in headaches and then have them diagnose the specific migraine that you have. There's different medications for different migraines, is my understanding. And then try to get ones that will help potentially prevent it from coming on. They also have ones that will try to break it once it's come on, but it's better to try to get on something that will prevent them.
Can puzzles help with keeping your brain healthy?
Yeah, we just did it. Didn't we do a TikTok on this?
I know, but they probably haven't seen it.
Oh yeah, so we did. Yeah, it's one of these things that to keep your brain healthy, you want to keep it active. So crossword puzzles and learning a new language, playing a new instrument, things that you're not used to doing. Use your left hand instead of your right hand when you brush your teeth. Things that your brain's not used to it helps keep it healthy.
When this person wants to know, what was your high school GPA when graduating?
Yeah, I don't remember. I don't think it's that awesome. I mean, it's probably like a B plus, I think, out of high school, maybe. I definitely didn't have straight A's in high school.
Yeah, but it gets more important, right? Like as you go from one thing to the next.
Yeah.
To
because
college.
I went to the University of Toledo. I mean, when I went there, it wasn't that hard to get into at all. So I don't think.
This person said crosswords or Sudoku.
Both. My wife does a lot of Sudoku.
I don't know what this means, but do you think a cingulotomy is for pain control? Does that make any sense?
A cingulotomy.
Cingulotomy or MY?
Yeah, I don't know if that is for pain control. I mean, there's different rhizotomies you can do and dorsal root ganglion ablations and things like that, but I don't know.
I'm not sure what this person means, but this might make sense to you. Are you able to talk about the future of stereotactic and functional neurosurgery and what direction you think those fields are going to?
I'm not. I don't do a lot of stereotactic brain surgery, and a lot of that is. Are you talking about? It's like somebody has a brain tumor, we do stereotactic radiosurgery. I mean, that's evolving all the time, so it's not invasive, and they use focused beam radiation to try to treat the brain tumor. But I don't know enough about it to tell you.
Said, hello, doctor. How do you keep that work-life balance? You look pretty relaxed. Do you meditate or are you religious?
I mean, work life balance. That's something you just have to decide. Like I see so many people who stay at the hospital till like 8 or 9 o'clock at night, and that's their choice. So you have to make an active choice. So I make an active choice that when I'm done for the day, I come home and I enjoy my time at home with my family. I used to meditate for a while. Actually, it was very helpful. I stopped doing it recently, but definitely I would meditate like 10 or 15 minutes before I went to work every morning, and I think it definitely made a big difference.
Yeah, and also it's different. Like you're further in your career versus when you first started, right?
For what?
Like work life balance, you're not gonna have as much work life
Yeah,
balance
I had
going
no.
through
I
it.
mean, earlier on, I had no work life balance. I mean, Kevin can tell I never was home, but
So I mean, just like any career, as you go further along, you have more you can have more
right.
balance. Like residency, you're not gonna have as much balance. Um, do you have to know anatomy and physiology to become a surgical tech?
I don't know. I mean, I don't know as if they do. I mean, but they have a certain set of classes they have to go through to become a surgical tech. So maybe those are included. Some of those classes, I don't know.
So, what is the craziest name you have seen while working in the medical field?
The craziest name?
Yeah, I don't know.
No
That's
idea.
thanks for your open and great videos, or great and open videos.
Oh, thanks for the compliment.
What about having steady hands?
I mean, you gotta have pretty steady hands, right? But I've seen surgeons have slight tremors to their hands, and they're still good surgeons. So
Yeah,
it doesn't have to be perfectly still.
well, you can have your hand too, like when
Yeah,
you put
but
on.
there's times like today when I was doing a surgery. I mean, when I have the knife next to the nerve, I mean I can be a millimeter away, so you have to have a pretty steady hand because if you're tremoring, you're gonna hurt the nerve. What?
Say hi, cat.
Hi, cat who?
Eh, Madison's friends.
Oh, okay.
She put Madison's Kevin laughing at us. All right.
Why is Madison on there?
I don't know. I think she's
Oh,
good. I have a stable cavernous
angioma.
angioma in my left parietal lobe. Do you see many of those?
Yeah, I mean cavernous angiomas are they're like a benign tangle of blood vessels, and so most of the time you don't need to operate on them unless they keep bleeding. If they keep bleeding, then often they have to be resected. But most cavernous angiomas you can follow conservatively with just serial MRIs. You follow get MRIs every once in a while.
Oh, this person said I meant what is the craziest thing you have seen while in the medical field?
Craziest thing.
Yeah, just
I can't. There's so many. I just I can't talk about stuff like that because if the patient ever heard me talking about their story,
probably
I'd
when
get
you're on
so
trauma
upset.
call though, like just
But I've
someone.
seen a lot of crazy things to the brain, things jammed into the brain, skulls broken off. People come in with half their skull gone. I mean, I've seen gunshot wounds. Big bullets in people's spinal canals. So I've seen a lot of different stuff. But
What was your major in college?
Bachelor of Arts. A lot of people ask questions about that. I don't know. I think you just have a certain set of requirements you have to get into medical school. So I think, there's lots of people who have a degree that maybe is psychology based or is English based or something. I don't think you have to have Bachelor of Science to get into medical school. I think there's other degrees you can get.
What are side effects for a shunt brain surgery and cranioplasty, and is it dangerous?
Well, side effects of a shunt, like you're going to put a shunt in somebody, that's so when people have fluid buildup in their brain, we put shunts in to drain the fluid, and then you put that tube into the abdomen. So side effects you can have is, do you mean it? If the surgery goes, say the surgery goes well and there's no complications from surgery, what can happen? Sometimes the shunt can drain too much fluid and cause headaches. Sometimes the shunt can stop working and they have to do surgery again to repair the shunt and put a new one in. So things like that. If it gets infected, then you got to take the shunt out.
That's a good question. Doctor, do you have any advice for people who probably should have spine surgery, but worry about going through all the pain without improvement, since sometimes people may not improve after surgery?
Yeah, so that's probably when I see people in the office, that's probably the biggest thing that they're worried about is are they going to get better? And so, all I tell people is I can talk to them, look at their films, and by putting those two together, I can pretty much tell if a person's going to get better after surgery or not. So I think if you pick the right patient with the right symptoms, people do wonderfully. And so I tell my patients, I'm not going to operate on somebody if I don't think they're going to get better. So a lot of people come in and I tell them I don't think surgery's going to help and I don't operate on them. So most of my people come back and do well because I only operate on who I think I can help.
What's the youngest patient you operated on? Do you know?
Well, I know for back surgery, the youngest patient is probably 9 or 10 years old, but the youngest patient I've operated on is an infant. I mean, an infant.
What's your longest surgery or operation you've done before?
Probably like 16 hours, right around there.
So yeah, if you guys are liking the stream, make sure to give it a like and share it, and
Yeah, we're new on YouTube here, so we're trying to do some live YouTube.
yeah. So Madison
Oh.
said he is very much married. Madison's my girlfriend, for anyone who's wondering. I got DBS for tremors.
Yeah, so DBS, I mean, that's deep brain stimulation. Do you have an implantable one? Is it implanted in you?
Can sciatica ever truly be eliminated?
Yeah, I mean, if it depends what your sciatica is from, but we just put out a little video on that too, I think. So sciatica just means you have a pinched nerve in your back that causes pain down the sciatic nerve, which is the pain you get in your butt and down the leg. So, if you have a pinched nerve and you unpinch it, one of the surgeries I did today was just for that. The leg pain will go away. So, I mean, you can solve sciatica if it's from a pinched nerve. Now, if it's from nerve damage or an injury, you may not be able to solve sciatica.
Which book is the best to learn neurosurgery?
I would say it's right over there. It's called the Handbook of Neurosurgery. I used it to review for my boards. They've had like 7 editions now, so this is an old edition. This is probably one I had from residency. This is second edition. I think they're up to like 9th or 10th edition. It's a lot bigger now, but this has like everything you need to know about neurosurgery. I still refer to it today, and this is what I use to study for my boards. And I read this book probably 3 times through. It's great.
Are you and Kevin still doing the fitness journey?
We are actually, and we've got some exciting ideas coming up for that pretty soon. So we're definitely still doing that. We picked up our packet tonight. We're doing a 5K this Saturday. And then after the 5K, we're going to make an announcement of a new race we're going to do and maybe bring one lucky person.
You want to just talk about it? You can just tell. We could.
Yeah, so I mean, what we want to do is...
Or what the idea is.
Yeah, so our idea is I want to give somebody a chance to... give somebody a chance to do something they've always wanted to do. So a lot of people only dream of like doing a half marathon or even a marathon or an Ironman. So we'll start out slow. I don't know if we'll start with a half marathon or the marathon, but I'd like to take one person who is very interested in doing something they haven't done before. You got to have a little running experience. I think you have to have run a 5K before, but I'd like to have them journey along with us. And then depending on where we do it, ultimately when we do the marathon, if we go to a different city, I'd like to, sponsor that person, pay for them to go on the trip with us, put them up in a hotel, run the race with us, and
we'll help motivate them along the way.
Yeah,
just tell them our training and stuff, and then pay for all their stuff to help them out.
But I mean, just so somebody can experience doing something they never thought was possible. We'll probably have people send in videos to tell us why they want to do it, why they want to do this journey with us, and maybe tell us a little bit about your health and your running experience. But I thought it'd be pretty cool. I mean, I'd love to do that. I'm going to use my own money to pay for it. I just think it'd be cool to take somebody along with us. I never thought I could do an Ironman in a million years. And then after my son died, I decided I'm going to try to do it. And I started out running really slow, just like a 5K, and worked my way up to an Ironman. I did it. So you can do anything you want to do. Obviously, you have to have a certain degree of health. I understand that. But I think you can do anything in this life if you want. You just got to put your mind to it. So we'd like to take one person and let them have that experience.
This person said do the Chicago Marathon, which that could be.
Yeah.
Be pretty good. Yeah, we're only 4 hours from Chicago.
Can you get in this? Do you have to?
I think Chicago. I think Chicago's a lottery. It's not like
it's not a lottery then.
There's no time requirement.
Okay, but some of these races you have, like New York, you have to get a lottery.
No, but New York's time based and there's lottery. Okay. Right. Chicago.
It'll be someplace cool when we do it.
But Chicago, I think, is more. You can get in more. When did you at what age start having a better work-life balance? Would you say?
What do you think, Kevin? I was when I used to get home when we lived in St. James Woods. I mean, I'd still get home at 7, 8 o'clock at night. So.
Okay.
I'd
say probably once Brian died, you definitely worked less.
Yeah.
But
so I would say I started in private practice like 33 or 35, maybe age 48, maybe 15 years later, I slowed down a little bit. But I enjoyed it. I enjoyed being busy when you're. It's part of the reason you go into neurosurgery. It's exciting, and I was busy, and I wanted to be busy, and I think
How did he die?
car accident. He was drunk driving, hit a tree.
Okay. Uh, what do you think about calcium electroporation? Doing research on it now.
I don't know anything about it. I don't. Sorry.
Let's see. Um, have you ever worked overseas? Do neurosurgeons do Doctors Without Borders?
I don't know exactly what that is, but I kind of know what you mean. So no, I've not worked overseas, but you mean like a
There's
trip, like a mercenary, like a mission trip that you would do?
That's like a huge like nonprofit or something.
Yeah.
I think it's called. I think it's called differently, like in English. I
It's
think
like
it's
a
like.
mission trip.
So yeah,
Right?
it's like Physicians Without Borders or
Yeah.
Doctors Without
I
Borders.
know a couple people have done it that are in medicine, but I don't. I've never done it.
I think it's kind of like the Peace Corps, but doctors they just go around to
Yeah.
different areas they're needed. I heard you can do surgery on a brain tumor from the nose if it is deep enough.
Well, no. So if you have a pituitary tumor, typically that's the tumor that you operate through the nose. So you go up through the nose, through the base of the skull. You have to chip away the bone over the base of the skull, and then the tumor will be right there. And then you take the tumor out under a microscope. So it is done through the nose. But remember, that's how the Egyptians used to take the brain out, is through the nose.
Are any of your kids neurosurgeons or doctors?
No.
My sister, his daughter, is in neuroscience though on the research side.
Yeah, Julie.
And
Julie's
creative
in
writing.
neuroscience. Yeah, so if you guys like this, give us some likes and subscribe to the channel. We're gonna start doing some cool stuff on YouTube.
Have she ever had someone play an instrument while performing? I think they're talking about like the brain, like in the awake brain surgery.
Yeah,
and stuff.
so when I was in residency, we did a lot of awake brain surgery, but I've never had somebody playing an instrument. But I remember, people talking. We would have them sing, do certain things. But it's pretty cool because, you have the brain exposed, and then somebody will be talking, and you stimulate a part of the brain, and all of a sudden they'll stop talking, and then you stop the stimulation, they'll start talking again. You stimulate it, they stop talking. So then you mark that spot in the brain because that's important. Because their speech, it's their speech center, and then you mark it so you don't resect it.
Have you ever had patient referral as a result of like social media, TikTok or YouTube?
Yeah, I've actually had a couple people come in and say the only reason I'm here is because I saw you or my daughter saw you on TikTok and said you should go to him. So yeah, actually.
You did my grandma's surgery. Thank you for helping her.
Oh, you're welcome. Hopefully she's doing well.
I guess you have to have a strong stomach to do this type of surgery.
Well, it's like anything. You just gotta get used to it, right? When you first see blood and stuff, you might get nauseated and lightheaded, but once you see it enough, it doesn't faze you at all.
Y'all should start doing Instagram live. Wait, we'll try that sometime.
Kevin's looking through the questions.
Any thoughts on internal tremors? That they're having them a lot.
I don't know much about tremors. Obviously, that's something that neurology really handles. So I don't know much about it. There's different types of tremors, but they'd have to diagnose it, and then there's certain medications you can try or deep brain stimulation.
How to remember a lot of stuff for a long time as your neurosurgeon? Do you read a lot of books?
Yeah. I don't read a lot of books, but when I was training, I read like crazy. I read tons of stuff, but it was all in neurosurgery. You learn all this stuff in all these terms, and it just sticks with you. And when I was younger, I could just read my notes or books, and I'd remember exactly where stuff was in the book. And when I took tests, I could remember exactly where I read it in my notes. But as you get older too, you don't remember stuff quite as well. So,
is recovery from brain surgery hard? And do you have to be immobile constantly? And since blood goes to the head when you're upside down, is that a no-no?
Well, recovering from brain surgery is not as bad as you think, right? So really, the only pain people have is the incision of the scalp pain, and maybe go through the muscle. But people recover very quickly from brain surgery because remember, the brain doesn't have pain receptors, and so it's not a real painful surgery, and most people can get back to pretty normal life within a month, I think.
We just answered your question, Iron Shark. And we just talked
Okay,
about
all right.
recovery from brain surgery. Is it possible to rectify or reverse dementia with brain surgery?
Not that I know of. Because dementia is a problem with the brain itself. So it's
It's, in what form memory gets stored? Is it in the DNA of neurons? The questions.
I mean, memory is really just it's a chemical reaction from neurotransmitters in the brain that helps store the memory. But so it's more of like an electrical conduction of storage. But
Um, when you do any surgery, how deep do you need to make an incision? What complications could arise, and how would you fix it?
go say it again.
When you do any surgery, how deep do you need to make the incision?
Well, the incision you make through the skin, right? And then you have to go down. Like I'm going to the spine. I mean, sometimes I have to go down that deep to get to the spine, literally. So
Depends on how
it depends how big
the
the
weight
person
of the
is and how big
person.
their muscles are, and so you have to go as deep as you have to go, I guess.
Um, when did you realize you wanted to be a neurosurgeon? Early on or in med school?
I in late high school, in my senior high school, I knew what I would do.
Do you believe in IQ?
I mean, I'm sure there's some basis to IQs. I mean, but I don't. I've never even taken an IQ test, so I don't really know the test itself. But
Do you have a favorite beer?
Blue Moon.
Is it normal to have different dents and bumps on your skull?
Um, honestly, you can't. Not really. I mean, unless you've had a fracture in the past or something like that, or you have some erosion of the bone. But
Um, have you seen any miracles?
I mean, I've seen a few miracles. I mean, I had a guy once who, long time ago, was a priest, and he came into the emergency department really almost. I mean, he was pretty much dead, and his family really wanted me to take him to surgery. He had a blood clot over his brain, and I took him down to surgery right away. And took the blood clot off, and he just made a complete recovery back to completely normal. So that, to me, that was a miracle. I mean, I didn't think he would even survive, let alone be normal after that. And I had the teacher who came in with a ruptured aneurysm who was really almost the same way, and I operated on her and took care of her aneurysm. 6 months later, she was teaching school again. So there are a lot of stories out there.
Okay. What do you love most about neurosurgery, and what do you wish you could change about the field?
I mean, what I love most about nurses is just helping people. It's so gratifying when you take somebody who's in horrible pain or can't walk anymore, or they have weakness, and then you do surgery on them, and then they're out playing golf and running, and they come up to you and say, "Hey, thank you. You changed my life, and I, could never do any of this stuff without you." I mean, that's the stuff that makes it all worthwhile.
How many hours do you sleep every night, and how many hours would you sleep if you could sleep as much as you want?
I mean, I try to get 7 to 8 hours at least every night. So I go to bed early, but I get up early. I try to get 7 to 8. When I was working more hours and on call a lot, some nights I wouldn't sleep. Some nights I'd only get 2 or 3 hours. I don't think I'd want to sleep more than. I mean, for me, more than 8 hours. I don't think 8 or 9 hours. I wouldn't want to sleep more than that.
Where are you located?
Toledo, Ohio.
This person said, do you ever wear diapers during long surgeries?
It's not a bad idea, but no.
Have you ever heard about that? Oh, this is a good one. Have you ever heard about Dr. Death, a neurosurgeon who maimed his patients?
Yeah, we started watching the series on that, and I had to stop after about 4 or 5 episodes. I stopped watching. I've never finished it because it's nauseating to watch. I mean, it makes me nervous just watching it that somebody could actually do that. I mean,
yeah. So tell him it's like a documentary with Alec Baldwin, right? About Dr. Death.
Yeah, it's a documentary about a neurosurgeon who just somehow was out there operating, and he was maiming people. I mean, killing people and maiming people and doing stuff that all the surgeries he did, I do, and just thinking about how can this happen, and it just makes me nervous. Like, God, could this ever happen to me? But I mean, I think the guy was just so. I don't think he knew. He must have not known his anatomy. He must not have known how to operate. I mean,
this person said, was he incompetent or psychopathic? Well, you should watch that documentary.
I think both.
Yeah, he thought he was he thought he was God.
Yeah, I mean, he seemed to have no remorse from, I mean, this is a series, but then I think they showed some of the real stuff too, and it sounds like he had no remorse. I mean, he injures people, and he thinks it's somebody else's fault, not his fault.
Do you work with surgical interns?
Surgical interns. We don't really have like a residency program, so I don't really have medical students or residents with me now.
From which medical school did you graduate?
Medical College of Ohio here in Toledo.
Um, I have nocturnal epilepsy, but I have just started to drink 2 liters of water and my seizures haven't come back yet. Any thoughts on what could be going on?
Yeah, again, this one of these fields that, epilepsy I don't treat, and I don't know as much about it as I'd like to tell you, so I mean, I can't really answer that question.
Okay, a couple people are asking about Neuralink, Elon Musk thing. Like, what are your thoughts on that?
I mean, I think it'll be something definitely in the future that's going to be big. But I think it's going to take time. I think it's in the early stages, and they're having a I might so what the neurosurgeon would do is drill the hole through the skull, and then a robot implants these things into the brain and maybe the spinal cord. But I think it's got a long way to go. And what do you do when the thing fails or needs to be taken out? It's going to be hard to take these out when they're all scarred to the brain and the spinal cord. So I think it's in the early stages. I think it's a great idea. I think it's got a lot of potential to help people who can't help themselves. Somebody who's paralyzed who wants to interact with a computer but can't. I mean, Neuralink can help them do that.
So, what's the biggest remaining mystery of the brain?
Consciousness. I mean, I don't think people really know, like, what makes you you? Like, what makes you know that you are you? And nobody knows that.
Have you ever been threatened by someone for losing a patient? What protocols do you have to follow?
Yeah, I've never been threatened by losing a patient. I don't know the protocols. Probably have to report it.
What do you think of cryopreservation of the brain?
Oh yeah, like freezing.
I think they're mean freezing.
I mean, there's people out there. I mean, there's a lot of people that have had themselves cryogenically frozen. So hopefully in the future, if we find a cure for their disease, they can be rewarmed up. But so I don't know what's out there or the research on it right now. But
are we done?
Yeah, are you
okay.
Okay. All right. Well, yeah. Thanks, you guys. This was fun, and hope you enjoyed it. And then we'll try to do this again soon.
Yeah, just follow. We put out videos, and we'll try to do some more lives. If you guys usually enjoy these.
Have a great night.
All right, have a good one, guys.